So November 14th is World Diabetes Day, and this year's theme is Protect Our Future. So diabetes, as I'm sure you know, is becoming an epidemic, with estimated 9 million Canadians being diagnosed with prediabetes or diabetes, which means that even more people are probably living with diabetes but don't yet know it. Diet's an important part of either managing your diabetes once you have it or preventing diabetes from coming. One typical thing that we like to say is the healthy plate model, and this applies to everybody, so the whole family, not just people with diabetes. Healthy plate model consists of a balance of protein, starch, and vegetables. Plates are getting bigger as time goes on, so we like to use our hands for portion control. Portion of starch would be about a fist or a small softball, depending on your fist size. About a palm size or a deck of cards of protein, the thickness of your pinky finger, and then 2 handsful of vegetables, or basically as many vegetables as you like. They're not going to affect the blood sugar. For your starches, you want to make sure that they're high fiber, so choosing whole wheat, whole grain products over the white products, and this is because of fiber. So fiber takes a long time to go through our system. It's not actually absorbed by the body, and so it helps to slow down how quickly the glucose from the food is absorbed into our bloodstream and helps to maintain better blood glucose values and helps to keep you full. Balancing your meals, spacing your meals no more than 4 to 6 hours apart helps to maintain healthy, regular blood glucose levels in your body, as well as to maintain a healthy weight. Physical activity is another important part as well, both aerobic and resistance activity. Doesn't mean you have to go to the gym, but using what you have available. Maintaining a healthy weight is a good sign that your food you're eating and the exercise you're doing is all balancing out. If you have diabetes, checking your blood glucose 2 hours after a meal is a good way to know, has the food worked for you, or maybe is it a little bit too much, a little bit too sugary? The Canadian Diabetes Association says if the blood glucose is less than 10, then it's fine. If it's above 10, you may want to reconsider some things at the meal or maybe look at the medication you're taking. There are lots of different risk factors, some of which you can't control, so age, having high blood pressure, high cholesterol, family history, certain ethnicities are at higher risk, but definitely what you can control is diet and exercise. So making sure you have a balanced diet, eating healthy foods, eating regularly, and regular exercise. 150 minutes a week of aerobic activity is recommended, plus some resistance activity. Those are doing your steps that you can to either prevent diabetes or to manage it if you have it. If you're healthy, go see your doctor for regular checkups. Very important, especially over the age of 40, as that's when your risk for type 2 diabetes increases, or earlier if you have family history of diabetes.